Australian Medical Association says a plan to charge for car parking at the state's public hospitals puts the sick and elderly at risk. But the state government is pushing ahead with its parking charges plan despite the opposition.
From the middle of next month, staff and visitors to the Modbury Hospital and the Hampstead Rehabilitation Centre will pay up to $13 a day for a car park. SA Health says the move is necessary to cover the department's costs. The Australian Medical Association is worried it will scare some patients away from hospital.
I think there are people with chronic disability attending rehabilitation who will no longer attend because of the barrier put in place by the government.
The AMA says many patients and staff have no choice but to drive to and from hospital. It says the government should take that into account in deciding how to raise money from parking charges.
Hampstead Rehabilitation particularly doesn't have ideal public transport, but the other centres do. So I think they're different issues.
Metropolitan councils are also worried about the plan.
If they're not parking in the hospital, they'll go into the side streets, they will go over to the Westfields area and over to where some of the Obarn parking is, and will actually exacerbate the already existing problems that we have.
Staff from SA Health met with the council yesterday to discuss car parking issues here at Modbury Hospital, but the council says that was too little, too late.
My issue with that is the horse has already bolted, the decision has already been made, there's been no dialogue with the key stakeholders.
SA Health says it's working with all councils affected by the car parking decision. It plans to start charging for parking at several hospitals around Adelaide later in the year. Stephen Smiley, ABC News, Adelaide.